Hi, so today we're going to talk a little bit about knee pain and how we manage, and as with all of the short videos that I do around body health, I'd just like to explain a little bit about the anatomy and physiology so that it helps you to understand how the knee works along with the mechanics of the knee. So if you think about and we look at our joints and our range of movement, the knee has the option, it's a hinge joint, of moving one or two ways, which is involved in extension, where we take the leg out, or flexion, which takes the leg back. Now, if you think about the actual bone and the anatomy of this area, we have a large bone called the femur. And then at the bottom, we have two bones, the tibia and the fibula. And the bones are connected via ligaments. So if you imagine they're strong and elastic and they bind the bones together. Now, around the knee itself, at the bottom of the femur and also the other connecting bones, you have cartilage, which most of us are aware of, but it has a protective mode, and it also helps to cushion and enable the movement of the joints to go smoothly. Now, when we have problems around the knee, the first thing that we would always address is the muscle balance. Sometimes it could be as simple as that the muscles are not balanced and one's pulling tighter on the other. Now, if you think about muscles, they all end in tendons, and tendons attach to the bone to enable the leg to flex, to let extend, and also flex. So by increasing that mobility, when you have a knee problem, sometimes those tendons get very tight. So one of the first things we would do is to actually get you to do some exercise and also some strengthening so that we can mobilize that joint, but also help to balance those muscles. And as we know that every muscle needs to be strengthened and stretched to kind of keep that mobility around the joint. And that's really important when it comes to all the joints in the body, that we keep it mobilized, increasing that flow. So, as I say, we're not going to go into all of the different muscles and where they attach, but the main ones we need to think about are our quadriceps, which are on the top of the leg, and also our hamstring area. Okay, so when we're looking at trying to release and address the issues around the knee, we need to have a look at those first. We need to check whether or not there is unnecessary tightness in the top of the leg and also underneath. So we would do that first of all by a series of stretching to release the muscle. Now, because of the knee, if you think about it, sometimes we'll focus on this area without looking at the lower part of the leg. The lower part of the leg, where we've got our tibia and fibula, the attachments which come from the ankles and go into the back of the knee and around the sides, what we need to look at is there a problem lower down that's causing the issues with the knee, or is it because there's a problem with the upper part of the leg? So when we start to examine the knee, and this is something, if you're experiencing pain, that I'd like you to have a look at, try and pinpoint, okay, where is it that I'm feeling an imbalance or tightness, so that you can start to focus on it. But as we know, we need to improve all of the muscles, because if we can balance them out, then it will take pressure around the knee area itself, where the muscles insert. Okay. So we first of all look at how we position ourselves and how we stand. As we'd always say, we encourage, and I'll just pop this camera down here, we encourage soft knees as much as we can to take that pressure off. But also there are a few basic stretches that we can bring in and basic strengthen to actually help to identify and rectify where the imbalance is. So I'll go through those with you after. The reason why I've got loose trousers on is going to show you a way of treating the knee yourself so that you can start to loosen the attachment areas around this region to try and take away some of that pain and that discomfort. Okay, so I'm going to just change the camera again so that you can see. So around the top of the knee and also around the quadriceps, which is this area of muscle, we need to find out if there is any areas where we feel the discomfort, and that can be done by just palpating around the knee area to find any what we call hot spots. Is there anything that's feeling a little bit uncomfortable? And sometimes you'll be able to pinpoint. Now, if you think about it, we're aiming with the muscles that attach all around, because deep inside of the ligaments, which it's very difficult to actually get to. Sometimes it's got some ligaments at the side, the collateral ligaments. Some people know about the meniscus in sports. But what we're interested in is loosening up so that we can take some of that discomfort away. So as with every treatment that you give to yourself, you would massage the area, you would mobilise. Now when you're doing the treatment yourself, when you rest your leg down, so I want you to do two different things. I want you to take the leg out and then use the thumbs to massage all around the knee area, the patella, which is the kneecap. You imagine that's like kind of like a protective, so that it's where what we call a sesamoid bone, and it's embedded in tissue rather than being connected to all the ligaments. So we would get the thumbs, we would push down, and we would start to just move and manipulate some of those tendons around the knee. Now you would do that with your knee bent around the area, so just two thumbs, and you would also do it with an extension. So extension is where the leg is out in front. Okay, massaging all around the knee. Now when we look at trigger point therapy, again with the specific points around the knee, we will place pressure, hold 20 seconds and release. And you can work around the area by placing thumbs and release, and take that around this region. Okay, so when we come to the side, to ligaments around the collateral ligament, which is underneath where everything is inserted. Okay, we're going to start to apply a little bit of pressure outside, and again then you would hold the trigger points for about 30 seconds. Then where the leg is out in front, you would then go to the back of the knee. Now this can be quite a sensitive area. We call it the popliteal muscle, which sits at the back there. So placing your hands underneath and just pulling. It's almost like you're stretching the back of the knee round to the front, just to loosen that. Okay, and then give the knee a little rub. So when we first start to bring in some basic trigger point therapy work, and we start to work on loosening those muscles, we need to balance that with the right exercise. Now, a lot of people think you should kind of rest the knee if you're having a lot of problems, and that will take the pressure off. It's very important to keep mobilised, to keep that movement within the knee. Okay, so avoiding high impact initially, but walking, gently mobilising, doing a set of exercises will help to keep that area nice and mobile, encourage that the fluid around the joint area as well. Okay, so we've done some hands-on, we've just done some basic warming up of the area, increasing the blood flow, and now what we're going to do is we're going to work up the quadricep, and we're just going to push the thumbs in and work up the leg. So you're going from the knee, pushing out, from the centre, pushing out. Okay, and you would also do this underneath, so you push in and lift away, push in and lift away, and that's just to encourage that flow that balance again back into the muscles. So they're all the things that you can do to massage and just help keep those muscles from getting that bit tighter, which could cause the pain to the knee. But we know that there is a lot of other pathologies that could be the cause. Now, applying trigger points and working around the areas will help. It's going to help take away some of that pain, increase blood flow because you're applying those trigger points. So that's the first part, just some basic work around the knee. Okay, now if you're able to, you could place the leg up and do the treatment from underneath. But the important thing is to do the massage with the knee bent and extended. So I will be doing some exercises in the next video. Hope you find this helpful and look forward to seeing you soon. Thank you.